So this one's probably a bit of a tricky area, but I'm going to talk about kids going to doctors. We've talked about the privacy behind children going to see doctors on their own. I want to talk about sexual activity with kids. So if my 13-year-old came to you on their own and wanted to go on the contraceptive pill, would you need to inform me?
We would maintain confidentiality. If your 13-year-old came to me, we would have a discussion about why they wanted contraception, and was it consensual sex they were wanting to have.
Yeah.
We would always encourage them to discuss with you, but if they were adamant that they didn't want you to know, we would still give them the contraception.
Yeah.
And because we are looking after their health, and their health is at risk, potentially, if we don't do that. But as I said before, we do encourage people to discuss with parents, but we will maintain confidentiality if the young person wants it.
Okay, and does that also go for a pregnancy, an unwanted pregnancy, or not even unwanted, but a accidental pregnancy? And I guess as far as if that pregnancy ended up being an abortion, would that also be something that would be covered under the privacy?
It would. I would want to probably discuss with a colleague about the details of that particular case, but we do maintain confidentiality for young people if they request it, because sometimes the situation they're in is very complex.
And I guess if you weren't having the parents involved and this child was coming to you wanting advice and things, you would point them in the right direction. And again, all of these areas are confidential.
They're so confidential. But yes, we would want to put a support package, a network around that young person to look after them.
Yeah.
Yes.
And sorry, these are hard questions to ask. It's a hard subject. If a child came to you, they were sexually active, they were pregnant, and they didn't take any of the support offered, and you were concerned about what was going to happen to the child as far as if they don't tell their parents, if they don't tell anybody, they're only 13, then would you look into what would the procedure be?
Well, again, we would be looking after the health of the young person, but I would then be getting advice from other people who've got more experience in this, some of the youth health specialty people, and I'd get advice from them actually about how to handle that.
Yeah.